Dealing with negative elderly parents, effective strategies. In this video, we'll explore effective strategies for dealing with negative elderly parents. From fostering empathy and patience to establishing clear communication channels, we'll delve into practical tips to help you navigate these delicate situations with compassion and understanding. By implementing these strategies, you can foster a more harmonious relationship with your elderly parents while ensuring they receive the support and care they need during this stage of life. 10 helpful strategies for dealing with negative elderly parents. 1. Practice empathy and understanding towards your elderly parents. Try to see things from their perspective and understand the challenges they may be facing. 2. Communicate openly and honestly with your parents about their negative behavior or attitude. Express your concerns in a respectful manner and listen to their perspective. 3. Encourage social interaction and engagement to combat feelings of isolation and negativity. Encourage them to participate in activities they enjoy and maintain connections with friends and family. 4. Seek professional help if necessary. Consider consulting a therapist or counselor who specializes in working with the elderly to help navigate difficult emotions and behaviors. 5. Set boundaries while maintaining respect. It's important to establish boundaries to protect your own well-being, but do so with empathy and understanding for your parents' situation. Helpful strategies for dealing with negative elderly parents, continued. 6. Focus on promoting a positive environment. Encourage activities and hobbies that bring joy and fulfillment to your elderly parents' lives. 7. Educate yourself about aging and common challenges faced by the elderly. Understanding the physical and emotional changes that come with aging can help you approach negative behavior with more patience and empathy. 8. Practice self-care. Dealing with negative elderly parents can be emotionally taxing, so make sure to take care of your own mental and physical well-being. 9. Seek support from other family members or support groups. Sharing experiences and seeking advice from others who are dealing with similar situations can be valuable. 10. Stay patient and persistent. Dealing with negativity from elderly parents may require ongoing effort, but maintaining a positive and understanding approach can make a difference over time. Understanding the challenges of aging. As your elderly parents navigate the complexities of the aging process, they sometimes exhibit negative behavior which can be a manifestation of the profound changes they are facing. Recognizing the contributing factors that affect older adults can provide insights needed for family caregivers to extend the best care. Physical and mental health decline. Older parents may experience cognitive decline, including memory loss and challenges with simple tasks, which can be hallmarks of conditions such as Alzheimer's disease or other types of dementia. For some seniors, incontinence might cause sudden changes in behavior, while chronic pain can make daily tasks difficult, leading to persistent negative attitudes. It's important for adult children to address any decline in physical health through appropriate personal care and medical support. Emotional and psychological effects. An elderly mother or father might display signs of depression or anxiety, often concealing their struggle until it becomes apparent through negative behavior. Ensuring they maintain social activities can help mitigate some emotional distress. Effective communication strategies. When interacting with aging parents who display negative emotions, family members should prioritize strategies that promote communication and understanding to manage difficult behavior effectively. Active listening and empathy. To address anger, negativity, or a pessimistic attitude in elderly parents, you must practice active listening. This means giving your full attention to your parent, acknowledging their feelings, and responding with empathy. Show that you understand their negative feelings without dismissing them. For senior parents expressing sadness or frustration, this approach may help uncover the root cause of their negative attitude, such as chronic pain, memory loss, or a urinary tract infection that might be affecting their mood. Addressing negativity and complaints. Handling negative behavior from older adults requires a delicate balance. If your parent is frequently exhibiting mood swings or a negative attitude, identify any possible triggers. Cognitive decline linked with conditions like Alzheimer's disease can often result in a sudden behavior change. When negative feelings persist, it's important to engage in social activities to counter the isolation that can exacerbate negativity. If these strategies do not help or if a mental health issue seems likely, seek professional help, such as a geriatric care manager or medical professional, to get a comprehensive evaluation of their physical and mental health. Addressing medical conditions and other underlying issues, like medication side effects, may improve their outlook. Creating a supportive environment. Crafting a supportive environment for negative elderly parents is paramount in mitigating negative emotions and promoting a positive atmosphere. It involves adapting the living space and daily routines to their evolving needs, ensuring their sense of autonomy and independence are honored. Establishing a routine. Routine provides a sense of control and stability for older adults, especially those experiencing cognitive decline or chronic conditions like Alzheimer's disease. Consistent daily routines can help mitigate confusion and anxiety, making your elderly mother or father feel more secure. Involving seniors in decision-making. Family members should involve older adults in care decisions to maintain their autonomy and to ensure their best interests are at the center of all planning. This process helps reduce feelings of helplessness that might lead to a negative attitude. For challenging decisions related to personal care or dementia care, consult with a geriatric care manager or involve a trusted social worker to guide the conversation in a more productive line of conversation. Combat social isolation and loneliness by encouraging older people to engage in social activities that cater to their interests. Whether it's joining a support group, engaging in a new hobby, or simply having coffee with a close friend, maintaining an emotional connection with others can significantly impact mental health. If mobility is a concern, explore options such as community senior living events or in-home visits from team members of organizations like the Family Caregiver Alliance, ensuring your aging parents or difficult elderly parents continue to have a fulfilling social life. Navigating care options. When determining the best care for negative elderly parents, you will need to weigh the feasibility of in-home care against the advantages of professional assistance. In-home care versus professional help. In-home care is often the first approach for families wanting to support seniors in familiar surroundings. It allows for personal care tailored to your loved one's daily routines and can alleviate negative emotions when a trusted family member serves as the primary caregiver. Tasks can range from medication reminders to assistance with basic tasks like dressing and meal preparation. However, professional help, such as a professional caregiver, may be necessary when care needs advance beyond what can be managed at home. Professionals are trained to handle complex scenarios such as cognitive decline from Alzheimer's disease or chronic pain resulting from medical conditions. Understanding medication management. Medication management is vital, considering older adults often have multiple prescriptions. Mismanagement can lead to serious medication side effects or exacerbate existing mental health issues. Proper medication management can quell constant negativity of difficult elderly parents and is often the best way to maintain not just their health, but the whole family's peace of mind. Self-care for caregivers. Caring for negative elderly parents can be emotionally taxing. It is paramount for family caregivers to prioritize self-care to prevent burnout and maintain their own well-being amidst the challenges of caregiving. Setting healthy boundaries. Identify limits. As a caregiver, establishing what you can and cannot do is crucial. Setting healthy boundaries helps in managing the care needs of your senior parents while preserving your physical health and emotional well-being. Physical boundaries. Define how much of your time and energy can be dedicated to caregiving tasks. This could include creating a schedule for in-home care or arranging professional caregiver visits. Emotional boundaries. It's important to protect yourself from negative emotions that may arise from dealing with family members who display constant negativity. Establish limits on what is acceptable behavior. Finding resources and support. Leverage community resources. Look for local support services such as social workers, geriatric care managers, or support groups. Organizations like the Family Caregiver Alliance offer resources tailored to those caring for aging parents with cognitive decline or dementia care needs. Support groups. Connecting with others in support groups can provide a sense of purpose and relief from the isolation that often accompanies caregiving. Discussions can range from coping with medication side effects to handling sudden changes in behavior. Professional services. Enlisting aid from in-home help can offer a reprieve from daily tasks and enable you to take breaks, which is essential for your mental health. Create a support network. Having a close friend, family therapist, or medical professional to talk to can help in dealing with difficult elderly parents. Sharing the burden with team members or other family caregivers can alleviate the emotional toll and help you sustain a good relationship with your loved ones. Recap and conclusion. Dealing with negative elderly parents requires a delicate balance of empathy, patience, and effective communication. While it can be challenging at times, it's important to remember that negativity often stems from underlying issues such as physical discomfort, cognitive decline, or emotional distress. By approaching these situations with compassion and understanding, you can provide invaluable support to your elderly parents while strengthening your bond with them. By fostering open communication, prioritizing self-care, and seeking support when needed, you can navigate these challenges more effectively and maintain a positive relationship with your elderly parents. Ultimately, by embracing empathy and understanding, you can create a supportive environment where your elderly parents feel valued, respected, and loved, enhancing their quality of life and enriching your relationship with them for years to come. Thank you for watching. To read the full article, go to livingyourSeniorLife.com. The link can be found in the video description.